short of it is that every minute there is about 26 lakh rupees that is being spent by individuals towards healthcare, right? This number translates to roughly about $72 billion annually. 2009 I was a wealth manager, and at that point in time, eroded significantly, client portfolios had been significantly eroded, right? And the reason I considered a global MBA was that, before this I had never lived away from home. How HEC happened is a different story. I took my GMAT, and it's funny, I was always a very average student, but somehow the GMAT managed to, I managed to do reasonably well. I think wealth management shaped my belief about money. Okay, about how money is essentially nothing but a tool, right? But working in wealth management taught me about the fiduciary responsibility you have to have towards other people's money.
Can you give a bit of idea that how different it is within India and in terms of the globe?
But anyway, where things stand today, okay, what I think the big difference between 2016 and 2023, earlier on we were solving a convenience issue. Today, the problem that fintechs are solving is more a much deeper issue, which is access. I think 2016 was the beginning of a lot of things that we see fully scaled now. The access problem is only being solved because of the data depth that has been acquired over the last 5 years, right? Or 6 years. UPI is prevalent, card transactions are happening all over the place.
Cover a lot around your experience with the banking, with the fintechs. Now I'll try to understand, as you have been shifted to healthcare lending.
Sure.
Okay. So how that shift happened, and it still interests you when I talk with you?
That a lot of people, a majority of the people, there were two large use cases that stood out.
Okay.
या तो दुकानदार सोना दे रहा था कैश लेने के लिए, अपनी दुकान बढ़ाने के लिए, या लोग अपना सोना दे रहे थे, या कोई अपना सोना दे रहा था because they had a medical emergency in the family. Now, for me, that kind of touched healthcare lending, right? Unfortunately, has not seen a major shift. Right? Insurance penetration is low, right? People are spending money out of their own pocket. Roughly 26 lakh rupees are getting spent every minute out of private individuals' pocket on healthcare. Healthcare lending में एक और problem है. ये तीन historic data points तो हैं ही, but there is also the futuristic data point of what is going to be the outcome of this medical treatment.
And based on that,
exactly. Right? Which makes it extremely hard to underwrite because lenders are not doctors and doctors don't share data with lenders. Right? Even when lenders are taking doctors, they still are kind of blind towards the outcome because hospitals don't share data. Hospitals don't share data with lenders. Right? So, which is why you will see that people who are going through a critical care procedure in a hospital will get rejected. Right? People who are going through some sort of procedure where the outcome is not known will get rejected.
To get some insight about the term which you are talking right now, healthcare lending, and how different it is from the insurance covers,
Sure.
the insurance capabilities that we have. And if you like to cover this based on the demographics of India, but
insurance by its very definition, right, does not include things that are elective in nature. So, अगर आपको आंखों का इलाज कराना है, या अगर आपको फॉर एग्जाम्पल हेयर ट्रांसप्लांट कराना है, या आपको some sort of dental treatment कराना है, right? आप it's not covered, right? आपको बहुत दर्द हो रहा है आपके दांत में, right? It's an emergency because जितना दर्द फ्रैक्चर में हो रहा है उतना ही दर्द दांत के ट्रीटमेंट में हो रहा है, पर फ्रैक्चर की इंश्योरेंस कवर करती है और दांत का ट्रीटमेंट इंश्योरेंस नहीं कवर करती, right? So exclusions, right, in insurance, that's what creates what we call this out of pocket gap, which is what I told you is 26 lakh rupees a minute and $72 billion a year.
If you'd like to cover what kind of magic can be bring together to the healthcare sector in a collaboration with healthcare lending and fintech. Okay, how would you like to
What you're trying to do is that the amount of claims you have to settle should be less than the premium that you collect, right? COVID में that trend completely changed, right? COVID के बाद insurers की party हो. Nugget of information that your users would probably be interested in. So insurance stocks are good to buy right now. You're scared to make mistakes, right? Because ultimately you only learn from your mistakes.
And I'd like to add one more. Okay, be responsible for your health.
Yeah, I would agree with that.